Good evening. Now we are going to discuss the third topic, which is chromosomal disorder. So, what is chromosomal disorder? Chromosomal disorder, any syndrome characterized by the malformation or malfunctioning in any of the body's system caused by the abnormal chromosomal number or constitution. Normal human is characterized as chromosomal disorders. In normal human, there are 46 chromosomes arranged in pairs of 23. The pair vary in size and shape and are numbered by convection, and any criterial differentiation or disorder may result in chromosomal disorder. Studying in chromosomal Studying of human chromosome is we literally do the structure and inheritance by karyotyping. Chromosomal consist of Chromosomes consist of female 46XX of a male 46XY. Chromosomes are identified by their shapes, positions of their centromeres, and their binding patterns. Chromosomal nomenclature. As we know, we have labeled chromosome on the size of the arms. The short arm is named as P, and the long arm is labeled as Q, where P stands for petite and Q stands for QE. Each chromosome is divided into regions and labeled as P1 to P3 and so on, and Q1 to so on, counting outward for the centromeres regions and dividing them into bands and sublabeling them to P11.1, which are the sublabels of P11, and so on. The, it goes on. Types of chromosomal abnormalities. Primarily, there are two main chromosomal disorders. First of all is numerical abbreviations, and second of all is structure abbreviation. Numerical abbreviation relates to the change in number of the chromosome, whereas structural means change in the formation and the structure of the chromosome. We can see the structural abbreviation in form of rearrangements in the physical structure of chromosome, which may result in defects such as mental retardation, increased risk of infertility, aborting or miscarriages can be seen in these cases, and chromosomal breakage or unequal crossing overs are resulting in the forms of deletion, ring chromosome, duplication, translocation, inversion, insertion. Whereas when we see numerical abbreviation, the replication or significant propagation of chromosome changes are found in human consecutive present in all cells, and it happens due to the meiosis. Mosaic present in some cells due to the mitosis. Their presence they represent a significant cause of pregnancy loss, miscarriages, as well as abnormalities found in the child which have been born. Meiotic non-junctions are in part of them, which can be seen as non-junctioning and defined as unbalanced segmentation of chromosome leading to aneuploidy. May occur during meiosis 1, meiosis 2, when the homologous chromosomes are segregated to the opposite poles during meiosis 1, and during meiosis 2, when the two system chromatids separates at centromeres and segregate to the opposing poles. During aneuploidy, we can see 45XO, which is known as Turner syndrome. We have features, this is an example. We have features of Turner syndrome present in the newborn, including redented neck, skin, and peripheral lymph node edema, congenital heart defect, There is an increased risk of adrenal anomalies, hypertension, autoimmunity, thyroid diseases, and obesity. Autosomal aneuploidy, we have also Down syndrome of trisomy 21. We have dysmorphic facial appearance with flattened facial profile, flattened nasal bridge, and protruded tongue. As we know, we have polyploidy also, which occurs during the result of post-fertilization cleavage error, which can lead to triploidy or tetraploidy. Unparental disomy. Cells with UPD may have numerically balanced chromosomes complement but are unbalanced in terms of parental contributions. An egg with an extra chromosome is fertilized by the sperm which was missing that same chromosome. That means that a chromosome, the lacking chromosome, is fulfilled by the either her mother side or a parent side, father side can be constituted in this case. Mitochondrial diseases, in terms of mitochondrial cytopathy, refers to as diverse group of inheritance or acquired disorders. It is a heterozygous group of disorder which can occur across all the age groups. Different energy productions caused by the mitochondrial structure or the enzyme consisted within the organelles are based for the clinical features of this illness. Genetics of mitochondrial disorders. Mitochondria are the only location in of extrachromosomal DNA within the cells. They are under the dual genetic control of both nuclear DNA and mitochondrial genome. Mitochondrial DNA is 15, 16, 56, 9 nanopico double strand 16 kb in humans. Closed circular molecules located within the matrix of the double membrane mitochondria. Each human cell contains 100 of mitochondrial DNA molecules. Human mitochondrial DNA encodes 13 of the 89 subunit of mitochondria. Respiratory chains as well as small and large ribosomal RNAs and 22 tRNAs necessary for intramitochondrial protein synthesis. Comparison. Here is a comparison between the human nuclear and mitochondria. As we can see the characteristic nuclear genome and mitochondrial. The size, number of gene encoded, gene density, mode of inheritance, replication, translocation, and recombination are divided varying on their genome. For example, we have replication, the strand coupled mechanism that uses DNA polymerase A, whereas in strand coupled in mitochondria, displacement mode only use DNA polymerase gamma. Transcription, we have most genes are transcribed individually in nuclear genome, whereas in mitochondria, all genomes on both sides are transcribed on large polycystomes. We have difference in number of gene encoded. We have 23 haploid genes and 46 diploid genes cells in the nuclear genomes, whereas several thousand copies are required per cell in mitochondria. Why does mitochondria DNA mutate? So the reason of mutation is acquired 6 to 7 times in the rate of DNA, nuclear DNA, because of lack of histones, the close proximity of electron transport chain, exposing it to the high concentration of free radicals which can damage the nucleides, the lack of DNA repair mechanism which result in mutation of tRNA, rRNA, and protein transcripts. We can see the clinical manifestation as disorder due to mitochondrial mutations are heterogeneous and clinically manifest, range from single organ involved multisystemic diseases or the same mutation of different in the same mitochondrial DNA gene may give rise to very different clinical phenotypes, whereas the same phenotype may be due to different mutations. Variability in the clinical manifestation is due to several factors which may include the proportion of heteroplasmy or the modification effect of nuclear mitochondrial gene, varying the threshold of biochemical express for both mutation and the tissue involved. We have two basic classification, class 1 mutation and class 2 mutation, depending on the disorder of nuclear gene and mitochondrial DNA protein mutation, categorized as class 1 being disorder of nuclear gene and class 2 mutation being defined as mutation of mitochondrial DNA point. How do we diagnose this? So the complex inheritance patterns and clinical heterogeneity of mitochondrial diseases often result in incorrect or delayed diagnosis of the affected individual. The details of the clinical history of examination in conjunction with expressed interpretation of a complex as power storage laboratory result is often required to acquire diagnosis. The detailed family history is essential in detecting the maternal line of inheritance. We have non-invasive staining test, an electrocardiogram or echocardiogram may demonstrate the cardiomyopathy, cardiac conduction defects, the most common cardiac features, mitochondrial disorder. We have ophthalmological examination may disclose the presence of retinal pigmentation abnormalities or optic atrophy, and electroretinography may be indicated in optical cases. We have biochemical studies. Several laboratory studies may include serum lactate, pyruvate, plasma amino acid, CBC, electrolyte, creatinine phosphate, amino, and so on. There is no specific screening test first of all, so we need to conduct all of them. Elevated lactate is suggested but not specific. CSF lactate may be elevated in these cases. The lactate to the pyruvate ratio is important as each component individual, such as the ratio of greater than 20, is suggestive of a defect Oxford, of Oxford, where a ratio of less than 20 is the defect of Krebs cycle. Serum keratin phosphokinase Walls values are used normally for mitochondrial disorder, except in mitochondrial depletion. How do we analyze the mitochondrial DNA? Genetic analysis is needed for genetic counseling. In the patient fits a specific phenotype as followed, a blood or muscle test for a point mutation may be positive. Mitochondrial DNA length mutation is a common defect and are best detected by these cases in the screening from LHON and MELAS. Southern blot analysis in the total mitochondrial DNA extracts from blood lymphocytes. In some patients, the studies are negative despite clinical suspicions. There are underlying neurological issues which can cause seizures, which are basically used to given prevention of by avoiding valproic acid, antiphylactic drugs. We have spasticity in these patients. We have dys- dystonia in these patients. We have headaches, which can be avoided by acute non-NSAIDs and avoid aspirin and all in these patients. Thank you for listening.